Chronic kidney disease affects more than 700 million people worldwide. That's a staggering number, and it highlights just how urgent the need is for better treatments and prevention. Diabetes stands as the leading cause of CKD, and unfortunately, cardiovascular disease remains the top cause of death in these patients. But recent groundbreaking research is reshaping how I think about kidney disease and how I approach therapy. Let's dive into some of the most important findings from the work of Professor Rabbani, Professor El-Tanani, and their team. Their latest study takes a close look at two classes of diabetes drugs that are now playing a game-changing role in kidney protection: SGLT2 inhibitors and GLP-1 receptor agonists. First, let me set the stage for why this matters. CKD progression results from several interconnected processes: hyperfiltration, inflammation, oxidative stress, and fibrosis. Over time, these factors work together to slowly destroy kidney function, often ending in dialysis. But this is where SGLT2 inhibitors come in. These medications act right inside the proximal tubule of the kidney, reducing both glucose and sodium reabsorption. By doing this, they restore the kidney's natural feedback system, and crucially, they lower the dangerous pressure inside glomeruli. The end result? Less kidney stress, reduced inflammation, and a slower decline in kidney function overall. Major clinical trials like Credence, DAPA-CKD, and EMPA-Kidney back this up. They've shown SGLT2 inhibitors can reduce the risk of kidney failure by 25 to 40% in both diabetic and non-diabetic CKD. They also cut the risk of cardiovascular and renal deaths, a true breakthrough. Now let's talk about GLP-1 receptor agonists. While they were originally developed for diabetes and weight management, research shows these drugs also target key kidney pathways. GLP-1 RAs help lower oxidative stress, inflammation, and fibrosis, while also reducing blood pressure, albuminuria, and improving vascular function. Clinical trials like LEADER, SUSTAIN, and AWARD-7 confirm these benefits, showing slower kidney decline and fewer major cardiovascular events in patients treated with GLP-1 RAs. What's especially exciting is the potential synergy when SGLT2 inhibitors and GLP-1 RAs are used together. Each drug class targets different mechanisms: hemodynamic, metabolic, inflammatory, so the combined effect could be even greater kidney and heart protection. Early evidence points to this combination as a possible new standard of care. This is a paradigm shift. We're moving beyond just glucose control, aiming for whole system protection. For many patients, this could mean delaying or even avoiding dialysis or transplantation. As research continues, these therapies may soon become routine for both diabetic and non-diabetic CKD. Thanks to the meticulous work of Professor Rabbani, Professor El-Tanani, and their colleagues, the future of kidney care is looking brighter. If you found this helpful, don't forget to like, share, and subscribe for more updates on medical breakthroughs. I'm glad you watched. Let's keep improving kidney health together.